Hi everyone, I'm Vinay, an Associate Consultant with the National University Heart Centre, Singapore. And today we will start a new series called Common Encounters in Cardiac Care for Primary Care Doctors. Now, our first video in the series would be what's the target range for lipids in heart disease. The relationship between LDL and heart disease is very clear. As you can see from this chart, there is actually a linear relationship between the reduction of LDL as well as the reduction in cardiovascular events. In fact, for every 1 millimole of LDL reduction, there is an associated 22% reduction in cardiovascular events. What about other components of lipids such as high-density lipoprotein or HDL or triglycerides such as TG? So for TG, there is no clear direct relationship between TG and heart disease. For HDL, there is an inverse association between HDL and heart disease. However, no evidence from randomized controlled trials where increasing HDL actually reduces the risk of heart disease. This chart is taken from the European Society of Cardiology guidelines, and essentially the treatment target for LDL would relate to the risk stratification of the particular patient. For patients with established heart disease, they are considered very high cardiovascular risk, and their LDL targets should ideally be less than or equal to 1.4 millimoles per liter. And these are patients with both stable ischemic heart disease as well as patients with previous acute coronary syndrome. Other patients with very high cardiovascular risk would be patients with severe chronic kidney disease with an eGFR of less than 30, patients with DM with target organ damage, or patients with type 1 diabetes with a long duration for more than 20 years. So what are our treatment options to achieve such low LDL levels? Firstly, we start off with a high potency statin. Failing to reach the target, we add on an ezetimibe and subsequently a PCSK9 inhibitor. In practice, our typical doses for such medications would be an atorvastatin of 40 milligrams every night, ezetimibe of 10 milligrams, and for the PCSK9 inhibitor, we could use medications such as evolocumab of 140 milligrams fortnightly or 420 milligrams every month. Our local guidelines echo similar sentiments. This is the ACE clinical guideline on lipid management, and similarly, there is a target of LDL of less than 1.4 for patients with previous myocardial infarction, and for patients with otherwise stable coronary artery disease or peripheral arterial disease, the guidelines recommend a target of less than 1.8 millimoles. Thank you very much.